Joanne Tremblay here. I am very pleased that you're here today for your training video. I am the founder of Plymouth Medical. I founded this company 7 years ago with the vision of being a one-stop shop for regenerative clinics in North America. Today, we actually serve customers all over the world, and it's something that we're very, very proud about. As far as regenerative aesthetics are concerned, we're very, very pleased with the progress that we've made. Initially, we focused in orthobiologics for PRP, bone marrow, and adipose for intra-articular applications in orthopedics and pain management. But we're seeing such great results with aesthetics. And what I'm going to take you through today is the setup of your centrifuge, as well as very, very basic instructions on our new gold 20 ml single spin kit, which we are launching in the aesthetic market. The reason why we're launching it is because there's a lot of misinformation out there on the science of PRP, and a lot of commercially available kits out there that call themselves PRP kits when really truly they don't concentrate platelets at all. So PRP at the basis of it all is a concentration of platelets above 1 million platelets per microliter. So all of us have different baseline platelet counts on any given day. And these kits that we actually have available concentrate platelets to clinical therapeutic levels. And we even have, a number of different independently reviewed third-party white papers on our website that you can consult, where we've actually compared our kit to other kits out there on the market. We're very proud to also have peer-reviewed studies that were coming out for dermal rejuvenation, specifically showing that a course of 3 PRPs injected intradermally or subdermally can actually provide a therapeutic effect in rejuvenating one's skin. And patients are really excited about that. They're excited about the fact that they're not injecting a foreign substance that's made of, in a lab, but they're actually injecting their own cells that are involved in the healing of their skin. So we're very excited to basically enable you to repair, restore, and rejuvenate your patient's skin. And thank you for your business, and we're going to start with the training session. With your shipment of the centrifuge and the kits that you will have received at this point, you should have also received our startup pack. So Plymouth Medical is very, very keen on training, and we're always available to help you and support your team in getting the best possible outcomes for your patients. So first and foremost, this startup pack will have consisted of a draft consent form for PRP that you may want to sort of customize to your own needs. We also provided you with a checklist that includes all of the subcomponents of our kits, as well as our suggestions for other disposable products that you will use in a particular case. So for example, if you want to provide your patient with a little pain relief, topical anesthetics are not included in our kit. Would be happy to provide that for you, but they're not provided in the kits, and obviously that will help mitigate your patient's pain. Furthermore, given that you're going to be using PRP in different tissues, or you're going to be injecting PRP in different settings, we don't typically include the needles for the injection of PRP in our kit as well. So you'll have everything you need to process from A to Z, with the exception of the treatment needle, the topical anesthetic, as well as, there's some of our customers that actually prefer really quantifying the injectate. So they like to basically take a PRP down to either 1 ml or 3 ml Lorlock syringes to better control the delivery of PRP. So those would all be elements or disposable pieces of equipment that you want to buy separately to our kits. So Beyond the actual checklist and the consent form, you also will have received these step-by-step guides, or IFUs, or what we call instructions for use. These step-by-step guides are pictograms that have very, very clear instructions on how to process our kits, whether it be for a double spin 60 ml kit like this one, or a very, very simple single spin kit, which we're going to demonstrate for you today. So again, following these pictograms step by step will, for the most part, enable you to provide the best possible outcome per the manufacturer's instructions. Once you get a chance to open the actual centrifuge box, you will find a whole bunch of accessories in a white box. I'm going to show you the contents of this accessory box now and explain why they're so relevant. So you have counterbalances that are provided for every single kit that we have. It may be that you may only use one type of kit, in which case all these other counterbalances might not be suitable for your needs. We're also going to have a scale for you to use in weighing your sample. So centrifuges obviously work on the concept of a counterbalance. So once you put blood on one side, in order to spin it in a centrifuge, you're going to need to counterbalance that sample of blood with a water-based counterbalance. So that's another neat part of our system, is that, in other words, if you are having difficulty with a venipuncture, or you have a vein collapse, you can still really treat your patient because you can simply just remove water from the counterbalance and still spin the sample adequately. So a lot of commercially available kits out there have fixed counterbalances, and therefore you have to dilute your sample, which is never ideal in a clinical situation. So our 30 cc counterbalance look like this, and our 60 cc counterbalances are actually much, much wider in diameter. So you'll see the difference there in terms of the size of the counterbalance, as well as the size of our bucket inserts. Inside the actual accessory box, you'll also find the rotor, as well as a wrench. So once you've plugged in your centrifuge, we'll ask you to turn the on-off button at the back and press the open button here. This will basically unlock your centrifuge lid and enable you to set up your centrifuge. What you'll find inside the centrifuge is actually a ton of packing equipment to prevent the centrifuge from breaking in transit. We'll instruct you to basically remove that packing material until you're left with the actual center console with a sort of a metal nut at the top. So what you want to do is unhook that knot or that nut, and basically place your rotor and the washer on top, as well as the nut on top, and just tighten it with the wrench that's provided to you. Beyond that, you will also find these metal buckets. These are autoclavable buckets as well, in case you ever have any sort of blood accumulate in them, or any sort of contact. You can basically put these in an autoclave and clean them out. Typically our kits are all self-enclosed, so no blood or bone marrow adipose tends to they're all self-enclosed kits, so basically you shouldn't need to autoclave these, but they are autoclavable and cleanable if you need to. So these buckets will fit directly into the grooves of your rotor. What's nice about these buckets is once the centrifuge starts spinning, they swing at a full 90-degree angle, which is very different to a lot of the test tubes systems or PRP kits on the market that only spin at a 45-degree angle. Once you spin blood at a 90-degree angle for at a specific speed and time, you're going to get a perfect stratification of cells in the actual kit. You're also going to be able to find in your accessory box these 30 ml and 60 ml inserts. So you can see how these inserts are actually designed with our kit's diameter in mind. What's nice about these is that they fit perfectly inside the actual buckets themselves, and you can see how our kits will then not move around when they're being spun. The counterbalance for our 20 ml kit is obviously non-sterile. We can use any type of water here. I've actually just used tap water to fill the kit. So I'm just going to load 20 mLs of water in this kit, and you can see how that actually pushes our disc up. So in other words, if I take 20 mLs of anticoagulated blood in the kit now, it's very, very reasonable to assume that the water and the sample of blood will weigh exactly the same or within a couple of grams of each other, and that's why we provide a scale in our setup for you to confirm that. Even though it's a 20 ml kit, it still fits nice and snugly in our 30 ml insert because they're the same diameter. What we're going to be processing today is the AbsolutePRP Gold Kit. It's our brand new single spin 20 ml kit. This kit we're very, very excited about because it actually yields a therapeutic level of platelets. When we've quantified this kit in the lab and with our own hematology analyzers, our CBC analyzers, we found that this kit is able to concentrate PRP at around 2.5 to 3.5 times your patient's baseline level. For those of you that are sort of up to speed with a lot of the new science on this, you'll know that different injections of PRP benefit from different concentrations or doses of platelets. And for the most part, hair restoration, dermal rejuvenation seems to start having a therapeutic effect at these concentrations. But you definitely need a concentration of platelet to elicit a rejuvenating effect or angiogenic effect on the dermis. And so we're very, very excited about this very, very simple kit. So we have a lot of our clients that basically asked us whether our double spin kits were suited for topical applications, and we found that those double spin kits, whilst they yielded a very, very high concentration of platelets for injection therapy, for knee away, or for even sort of spinal indications, we found that that was obviously very overwhelming for some clients to basically manipulate for simple topical applications post microneedle or even post laser. All right, so here you've got the AbsolutePRP Gold Kit. I basically put out all of the contents of the kit on this Mayo stand. What we like to do is show you how to set up, obviously keeping the sterile field in mind, working from left to right. This just makes things much simpler when you're following the step-by-step instructions for use, which will be provided with your setup as well. So first and foremost, the contents of the kit. This kit comes with 10 mLs of anticoagulant citrate dextrose, so ACDA, 10 mLs. You're only going to need 2 mLs for this, but this is a multi-dose vial, so you can go ahead and keep reusing this for within the 30 days of when it was first punctured. Our blood draw accessory kit comes with everything you need for the venipuncture, from the tourniquet, gauze, alcohol swabs, even down to the Band-Aid, a filter needle. This sort of green needle here is a filter needle that we'll use to aspirate the anticoagulant in a 20 ml syringe. And then we also have these sterile blue tops, as well as your butterfly needle. First 20 ml syringe will be used to actually draw the blood from the patient. We have a sterilely packed tube, which the PRP will spin in. This patented design basically contains a disc that basically moves up when you push your anticoagulated blood inside the tube. It also is designed to aspirate the PRP from the top to the bottom, thereby effectively separating red cells and inflammatory white cells from the PRP. It doesn't require a gel like other test tube systems to separate red cells and inflammatory white cells. The last 10 ml syringe is what you're going to be using to collect your PRP. Once again, if you like to work in sort of smaller increments, or if you like to control the actual volume of PRP that you're going to be injecting either in the scalp or intradermally, you may want to get additional 1 or 3 ml Lorlock syringes to administer the PRP. So these are the contents of our Absolute PRP Gold 20 ml kit. So I've gone ahead and drawn, per the IFU, 2 mLs of ACDA anticoagulant in my 20 ml syringe. I then took the butterfly and lured it onto the syringe. So I'm going to perform a routine venipuncture. I'll take the protective cap off. And we're just going to find the vein. I've already So now, what's important when you're taking blood like this is obviously making sure that the anticoagulant is mixing in nicely with the blood. The other thing you want to keep in mind is also you don't want to collapse the vein unnecessarily. So we want to take blood at about 1 milliliter per second. This is going to be nice and comfortable for the patient. It's also going to prevent any issues with the venipuncture. And again, we're taking 2 mLs of ACDA in the syringe plus 18 mLs of whole blood for a total of 20 mLs. So now I'm going to show you how to load the anticoagulated blood in the actual kit. So we've actually completed the first 2 steps of the process. Once I actually collect the blood is when I actually go and open the sterile pack. I just think it's good habit to do this in case you have any issues drawing blood. These are sterile packs here. So if they're not open, you can still reuse the actual kit itself. So what we're going to do is we're going to disconnect the butterfly. And this red top here is a sterile protector. So once we disconnect this red top, we're not going to reconnect it. So you're going to lure on your syringe and turn it clockwise to lock it. And then the next step is to slowly administer the anticoagulated blood inside the kit, as such. There we go. I'm going to disconnect. And you can use one of our alcohol swabs to clean the top of this tube. The white cap actually has a plastic protector on it, so I'm just going to go ahead and unhook that. And we're going to place the protective cap on top. And we're going to counterbalance this sample. So using the scale, we're going to weigh this sample and ensure that it's within plus or minus 3 grams of our actual water counterbalance. I've actually done this step before, and we took an exact amount of 20 cc's of anticoagulated blood. So you can more or less see that the counterbalance is going to be within that weight tolerance. So I'm just going to demonstrate how to counterbalance the sample versus the water. So you're going to want to ensure that your scale is set to 2 grams. I'm going to place the sample on the scale, and we've got a reading of 52.2 grams. So when we're processing in this centrifuge, we want a tolerance of plus or minus 3 grams. So this water sample here can be within 49.2 grams to 55.2 grams. So it's 51.2, so we're within the tolerance, so we're good to go. If we were outside of tolerance, we would need to adjust the water counterbalance by either removing or adding water to get as close as possible to the sample weight. Now I'm going to show you how to load the sample and the counterbalance in the centrifuge. So first and foremost, we want to open the centrifuge to unlock the lid. So now I'm going to place the sample in the centrifuge and the counterbalance on the opposite end. Now we're just going to want to ensure that the lid is closed. I'm going to select the Absolute PRP Gold. So if it's set on different spin times, you can just go ahead and keep going up or down until you get to the Absolute PRP Gold spin for a minute. And I'm going to press the start button. So now that the actual centrifuge spin has completed, you're going to hear a beep and the door is going to unlock. So you can go ahead and grab your sample of PRP. What's very, very important to do at this point once the blood has spun is to handle the PRP tube quite softly and cautiously. Obviously, at this point in time, all of the blood components have stratified, and we want to ensure that the blood doesn't mix back up together. So that's why we're going to place this tube right here in the tube holder, and we're going to collect the sample. You may see here that there's a little blood contamination in the tube itself. What we can do here is we can aspirate that blood out. Typically, the platelets remain in suspension on the top plasma portion. The red cells, obviously being the fatter cells, will migrate directly to the bottom of the tube. And the inflammatory white cells that we want to remove from the sample or the PRP will basically reside right under the red cell interface. So the stratification that occurs from centrifugation is exactly what we want it to do here. Often people ask us how much PRP they will get from this 20 ml kit, and that, as you can see here, will be directly related to your patient's hematocrit level. So depending on whether your patient has high hematocrit, you'll have less PRP. If your patient has a low hematocrit or less red blood cells in their blood, you will have more plasma to aspirate. So I'm going to demonstrate here how to purge this line. So I'm going to remove the protective cap. I'm going to swab it for sterility. I'm going to purge the red cell from the tube. And I'm going to access my PRP. So now what's important to do here is basically the disc will take your PRP from the top all the way down. And as soon as I get a nice red flash in my tube, I will stop aspirating. So you'll see that red flash in an instant here. So I want to stop aspirating now. So I know that I've basically collected as many platelets as possible. I've left the inflammatory red cells and white cells behind, and I'm ready to treat my patient with the sample. So from 20 mLs of anticoagulated blood, we're able to collect 6.5 mLs of PRP from this particular patient. If patient had a lower hematocrit level, we would have basically taken this up to 10 mLs. So you'll find fluctuations obviously in hematocrit between patients, whether you're treating mostly men or women. Whether they're on testosterone replacement therapy also affects the hematocrit level. Our kit actually comes with sterile blue tops, which you can place on your PRP. PRP is optimally used at the point of care, but if a patient needs to go and attend to an emergency, the PRP will remain good at room temperature for up to 6 hours. So thank you so much for your attention. What we're going to do is we're going to send this off to a lab now. Of the samples that we've actually characterized to date, we found that the concentration of platelets from our single spin 20 ml Absolute PRP kit was anywhere between 2.5 and 3.5 times baseline. And again, we'll be publishing white paper data to substantiate these claims. This obviously is a therapeutic PRP. We're recommending this single spin PRP to be applied topically, either in combination with a microneedling treatment or even post-laser. Some of our customers are actually very keen to use this type of PRP at the 3-time concentration for their hair injections, for hair restoration purposes, or to pre-treat hair follicles prior to follicular transplants. So we're very excited about this kit, and we're obviously open to your comments. If you wish to contact us directly, you can do so by contacting us through our website at www.plymouthmedical.com. Otherwise, we can be reached toll-free at 888-392-5076. Thank you so much for your attention, and I hope you enjoy your system.